Good morning. It's time to get in touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home. Every week, this public affairs show shines a spotlight on people and programs in our communities that improve the quality of life in Lycoming County and beyond. I'm Freddi Hammer, host of In Touch and news director at Backyard Broadcasting. Today, we're joined by Maggie Merk, a speech-language pathologist with Geisinger, Muncie, and Jersey Shore. She helps stroke survivors find their voice again, plus other patients finding their voice. Maggie plays a vital role in adult patient care, and we really want to know what speech therapy is all about, so we're excited to have Maggie Merk here today. Hi, how are you today?
Hi, Freddi. Thanks for having me. I'm doing well. How are you?
Good. I just love this area because I love to talk as a living, and I would be so sad if I couldn't. So I need you if it ever comes around, but I'm glad that people have you in their lives.
Well, you have me if you need me.
Thank you very much. I just want to know about what is your daily life like as a speech pathologist?
Oh my gosh, Freddi, that's such a loaded question. Well, first of all, I'm so glad that you invited us here to kind of talk about it. I think that when people hear speech language pathologist, they often think of kids learning how to pronounce their R's or S's or something like that in school, which is great. And we are absolutely certified to treat a lot of conditions like that. But what I do for Geisinger is I work in inpatient and outpatient care as a speech language pathologist, mostly with adults. So each day looks very, very different just because that can be a variety of conditions.
Sure.
But bottom line is we're kind of assessing what's going on and figuring out how we can help people communicate a little bit better, speak, talk, all of those kinds of things, swallow. However they need us, we're there to help.
So you have a team of people, I assume. You talk about the different conditions and kind of confer with each other. Is that how you do your integrated care model there at Geisinger?
Yes. So Geisinger's care model is all about that rich collaboration, and speech therapy can be a key player. So when an adult patient comes in, the speech language pathologist doesn't work alone or in isolation or anything. We're part of this really cool coordinated team that can include a primary care doctor, a neurologist, a physical and occupational therapist, surgeon, even a dietitian. I mean, the list just goes on. Our goal is to help each patient maintain dignity and ensuring their quality of life with whatever they're facing.
Sure.
The care we provide is personalized and streamlined. So let's just say a patient comes in, they have trouble swallowing during their head and neck cancer journey.
Okay.
The SLP might work along a nutritionist to ensure safe eating strategies while getting all the calories you need and avoiding the things that you don't need. We'll work with their surgical team to make sure we're promoting healing and understanding their course of treatment. We'll work with their radiologist, oncologist. That's common as well, to just kind of understand the whole span of what is expected so we can be proactive and make sure that we're taking our role seriously and helping them.
What would be the most common that you see? Do you see people with strokes, or is it this difficulty swallowing that you see the most of?
Gosh, that's such a tough question. It really depends.
Okay.
We treat a lot of people with stroke, traumatic brain injury, swallowing disorders. Those can arise from a variety of different conditions. So like Parkinson's or ALS, MS, really anything that can impact your swallowing. We treat a lot of things that also do kind of overlap.
You know, it's interesting. You think about physical therapy, and I hear people, I went to physical therapy and I was well in 3 weeks. It's like you're in the same business, physical therapy, but for speech. It's so interesting.
Yes, we can do a lot of different really cool things in terms of our therapies and the conditions that we treat.
Yeah.
One of the kind of connections that I make, because physical therapy is a little bit more well known, is think about physical therapy for your swallowing or physical therapy for your voice, physical therapy for your brain. It's kind of the same thing where I can't tack weights onto your throat. We can't work out your throat like that, but we can do it through, targeted exercises and really guiding you through the safest journey.
Some things are physical and then some things are more neurological too. So you really do have a whole gamut of things to treat.
Yes, we are really responsible to know a lot about a lot. So, I mean, even just with traumatic brain injury, I think that's kind of where speech therapy truly shines. So we need to learn a lot about the brain. We need to be compassionate while being clinical. And our goal with that is to just help patients regain their ability to communicate. And if their swallow has been impacted, swallow safely. And it's not just immediately following their diagnosis either. We're often with patients a little bit longer just because of the communication and swallowing impacts that we treat in adults. Those typically hang out a while, and we want to make sure that we're giving you all that we can in terms of our knowledge and sharing our knowledge with you so that you remain safe and you feel like you can get a piece of you back.
Do you have a different approach for each of the different kinds of therapies that you do? You know, when you're talking about the physical, the neurological, I'm sure you have a different approach to begin with your team.
Yeah, every single thing is different. So I guess the easiest way to answer that is to just kind of go through some of the conditions that we treat.
Okay.
So like with stroke recovery, that's mostly helping people regain their speech, their language, and their swallowing. With that, we also do a lot of caregiver or care partner counseling. Mm-hmm. You know, that way that you're not just getting the full benefit of everything while you're sitting in our office or while you're in the hospital bed. We want to make sure it's easy for you to carry over the strategies that we're suggesting into your home. We only see you for such a short snippet of time. So we really support the communication and cognitive function as well following that.
Okay.
If it's something like a neurological disease, such as a Parkinson's or ALS, we help with managing voice and vocal changes, speech clarity, and swallowing. Some days are better than others. So we also do a lot of rich, like, kind of counseling in these diagnoses just to make sure that we're kind of your cheerleader through it. You know, today might be a better day, tomorrow might not be, but we have the tools we need in order to kind of guide you through that. We do voice disorders, including even if you're hoarse or if you have vocal strain. So this can affect teachers, coaches, singers, public speakers, someone who uses their voice a lot. We walk you through the best way to do that in order to avoid that strain from continuing to happen. We treat a lot of conditions, including, you know, head and neck cancer, which I previously mentioned, dementia, whether you're in the beginning stages or kind of in the middle and need a little bit more guidance on how to make your life safer. We are really blessed to have a wealth of knowledge and see a huge variety of patients.
You know, about 10 years ago, a friend of mine had a dental procedure or something that happened where his vocal cords were affected. They nicked it with some sort of tool. And he came out of that as a radio person, not being able to talk. He was absolutely talking like that for weeks and weeks. And then it, boom, just went right back to normal. I wondered, would you be a person?
Goodness.
It was just amazing. It was like finally he was able to talk again. And I'm wondering, what would you have done in that circumstance? Like if you had someone with a vocal cord injury, is that also something that you would deal with?
Yes, absolutely. And we actually do see that pretty commonly as well, based on, you know, sometimes that is a secondary thing to a surgery or if somebody has been emergently intubated really quickly for, you know, a life-saving measure, sometimes that can just happen. So we are there as you recover to help pick up those pieces. We work really closely with ENT, which is ear, nose, and throat. And first of all, we want to make sure that we have the right diagnosis and the right care plan. So that's just kind of another example of our care partnership, making sure that we're working with the right discipline and not missing anything. But from there, we do kind of a thorough assessment to determine, I guess, kind of how bad the voice is in that snippet of time. And then treatment for that would include like vocal hygiene education, breathing techniques, specific individualized voice exercises to reduce strain and improve your vocal quality over time. Again, you can think of it like that physical therapy, but for your voice.
Do you ever have people that say, oh, I should have come in here so much sooner?
Yeah, all the time, all the time. So that's part of why I'm so glad that you had me here today so I can kind of talk about our really diverse role. We want to make sure that people in the community know that we're here. I know that people think of Geisinger as kind of a leading forefront in healthcare, and with that, we have all these really cool specialties that are popping up, especially in the more rural areas. And speech-language pathology is one of those. We've been able to do a lot recently in growing our team and some really cool technologies, just making sure that, you know, whatever you have, we can try to intervene early on so that you're not feeling those consequences in your daily life and that we can get you back to you.
So do people come into your office or do you ever do stuff online? I mean, how does people, when they start realizing, okay, I want to get speech therapy with a speech pathologist, do they make an appointment or do you ever get inpatient care going on in there?
Absolutely. So it really depends on the inpatient side of things. So you come into the hospital, let's say with a stroke, or maybe you have, you know, something else going on. And we're consulted if you're having difficulty with your speech, your language, your cognition, overall communication, your swallowing. If things are just not looking, sounding, feeling right, that's when they consult us. And we figure out in that really short snippet of time, what do we need to do right now, and how can we guide you through your rehabilitative journey? And so oftentimes that does roll over to our outpatient setting. And so we kind of continue a care plan. We make individualized treatment goals for people. They're oftentimes holistic in nature too. So I want to make sure that it's functional to you. Not every goal is going to be the same for every patient. Sometimes people want to be able to getting back to making their favorite recipes with their grandkids. Mm-hmm. Sometimes people want to be able to return to work. So we have to really break down those tasks. What do you do for work? And that looks different for everyone. So what do you do? What areas do we need to target? How can we make this sharper? So things like that is kind of the overall plan. And then oftentimes people will go to their PCP, their primary care physician, or a neurologist, or one of those other disciplines that we work with. And they will say, hey, I'm having this problem. What can I do? So that's where we get the majority of our outpatient referrals. They come from one of those other professions saying, hey, I think you need to see speech therapy. I think a huge delay with it is just that the misnomer that it's speech language pathology. A lot of people, oh, my speech is fine. I'm having trouble with my swallowing. But we're really lucky to have training and everything basically from the neck up.
We're on the line with Maggie Merk. She's a speech language pathologist with Geisinger, Muncie, and Jersey Shore. You say that you treat children as well. It's probably a little bit different for adults and children. You kind of have to diagnose maybe with smaller kids.
Yes, absolutely. I really love treating both populations. It's definitely a hard pivot from one to the other. Yeah, from kiddos, it's kind of, really making sure we're establishing communication and allowing them to communicate their wants and needs. That can look different for every single person. Sometimes that's using a device. Sometimes that's using sign language. Sometimes it's a gesture. Sometimes it's just building the vocabulary that they have or getting those words started. And that can also be the same for adults who have severe communication impairments. So there's a lot of similarities in that regard, but one of them I'm tailoring treatment to Bluey and like other kids shows, Paw Patrol. And then the other one, I'm figuring out, how do we get you back to work? How do we get you talking with your family a little bit easier? So it's definitely a pivot between the two, but there are a lot of similarities.
I'm sure people on your team, one handles the pediatric stuff a little bit more often than maybe another person on your team, I'm thinking.
A little bit, yes, but it's good. So you keep all your clinical skills very sharp. And, we really take pride in being on top of what is the most recent evidence showing us. How can we make this better? And as a speech language pathologist, you have to be responsible for knowing, like I've said before, a lot about a lot, different conditions, different ages. So you really want to stay sharp with those. And so it's nice to have one different kind of patient thrown in there, like a different adult, a different child, to make sure that we're being the best that we can be too.
I'm curious if people who have hearing impairments would be a good candidate for speech pathology, or is that a different area of care?
Absolutely. We also partner with audiologists.
Okay.
Hearing is one of those things that it's really tough because when you age, that's something that kind of, you might find yourself saying, what? Yeah. What did you say? Mm-hmm. I can't hear her. I can't understand her. Sometimes we might joke about that a little bit, but it can be very isolating. And social interactions, as humans, we're meant to be social beings. We're meant to want to talk and interact and get to know people. So when you have that sort of dwindling, again, it's isolating. It comes with a lot of feelings of negativity, but there's a lot that can be done. We want to intervene early with that because those pathways in our brain that are responsible for processing the information that we're taking in, it's kind of one of those, if you don't use it, you lose it things.
Oh, okay.
So we want to keep that sharp. And we often recommend, partnership with an audiologist, seeing if you need hearing aids or some sort of even amplification. So there's a lot of different varieties of things that we can do with that as well. But we want to make sure that we're kind of counseling you through that and also providing some strategies that you can use if there is a communication breakdown so you don't feel bad about it.
What would you say to families who are sort of facing this issue, maybe thinking, are they having any kind of fear or misconceptions about what it's all about and having speech therapy?
Part of our scope of practice is counseling and knowing how to deliver information while also guiding it through.
Yeah.
Me personally, I like to be pretty upfront with people, but also immediately come in and here's everything that we have to offer you. Here's everything that we can do. You know, it is tough, especially if you have a loved one that's like, I don't need that, I'm fine. So maybe gradually giving some suggestions. We do a lot of providing information, handouts and trainings and things like that to make you feel a little bit more confident in guiding your loved one through whatever is happening, as well as just emotional encouragement that, you know, sometimes this is a part of the natural aging process. Our knees start to hurt, everything's cracking more,
yes,
and our hearing is going. But growing older is a privilege that's unfortunately denied to many. So we're glad to be there along with the aging adult as well.
Well, that's awesome. I'm wondering, do you get out of bed in the morning and can't wait to go to work? Just you love your job? Is it really rewarding?
Honestly, yes. It is the most rewarding thing that I've ever done. I can't speak for all SLPs or those on my team, but to me, the most rewarding part about working with these clients is witnessing a transformation, not just in communication, but their confidence, their independence, and their connection. We don't really think about these things until they're reduced or taken away entirely from us.
That's true.
So helping them reclaim their voice, their identity, it's incredibly meaningful. And it's not always about those big wins. Sometimes it's a small victory, which is like, hey, I was able to get through a phone call with someone, or you know, I enjoyed a meal without being scared, without choking. That can make all the difference. So I do wake up really motivated to work with my team and get these answers for people. It is a pretty exhausting position because, as you know, Freddi, I talk all day. So, but in a very, very good and rewarding way.
You rest at home knowing you've done your job today.
Absolutely. I drive home in silence.
I do that too sometimes. If there's any foundations or things online that people can get some information from, or does Geisinger have any information that they've provided online for people to check out?
Yes. So if you go to geisinger.org, there is a search bar in the upper right-hand corner, and you can simply just search speech therapy. And then that will take you to our outpatient speech therapy services, things that are geared more towards children. There are tons and tons of resources there to kind of get you connected and give you a little bit more information. I also invite people to check out our national speech language hearing website. They can have a lot of really good resources for caregivers, and this is across the whole span. It gives you some developmental norms that you might be looking for in a pediatric patient. It also gives some really cool caregiver counseling resources, and that is at asha.org, ASHA.org.
Great. We'll put that on our website for folks to be able to check out, and they can click the link and get more information about speech pathology and speech pathologists like this, Maggie Merk from Geisinger, Muncie, and Jersey Shore. It's really been very informative today. Thanks for sharing your expertise and all the things that you've learned to do with us here on In Touch.
I'm so glad to be here today, and I really appreciate you giving us this space to share everything about speech language pathology and everything Geisinger can do.
Thanks again. In Touch is locally produced in our studios at 1685 4 Mile Drive in Williamsport. To get in touch with us for questions, comments, or topic ideas, call weekdays 570-323-8200 or email me at fhammer@backyardbroadcasting.com. For archived files of our In Touch shows, find our Backyard Podcasting link on any Backyard Broadcasting website, or subscribe to our YouTube channel, Backyard Broadcasting. The programming discussed here on In Touch does not necessarily reflect the feelings or opinions of the management or staff. Thanks for listening to In Touch. Brought to you by Geisinger, Muncie, and Jersey Shore. State-of-the-art healthcare close to home.